Have you been told that varicose veins are normal over time? That you just have to accept it, wear tight socks, and live with the pain? Well, they tricked you handsomely. The truth is that you can drastically reduce varicose veins in your legs naturally, quickly and effectively, without surgery, without spending a fortune, and without living on heavy medications. And no, we're not talking about magic. We're talking about strategies that most doctors won't tell you about, but that make perfect sense once you understand how the body works. What few people know is that poor circulation has a solution, and it starts with simple, accessible, and scientifically proven things. Essential oils, strategic foods, accurate exercises, and care that goes far beyond aesthetics. It's a matter of health. And the best? Results appear within weeks, sometimes even days. You know that swelling at the end of the afternoon, that feeling of heaviness, the nocturnal cramps, or even that urge to urinate at night that seems to have no explanation. All of this could be linked to your dilated veins. And yes, there is a way to change that scenario right now. In this video, you will learn a complete, straight-to-the-point and 100% natural step-by-step guide to dealing with varicose veins in an intelligent, safe, and effective way. And I'm going to show you why even using simple lavender or horse chestnut oil can change your game. Ready to find out what no one tells you about varicose veins in the legs? So, get ready, because what comes next could be the key to your vascular health. Have you ever stopped to think about why varicose veins like your legs so much? Well, they don't appear by chance. When the veins, which are supposed to carry blood back to the heart, begin to fail, blood accumulates. This happens because the internal valves of the veins, as if they were little doors, lose strength, and gravity, which never sleeps, pulls this blood downwards. The result: dilated, tortuous and visible veins that give an air of grace, especially after long periods of standing or sitting. And it's not just an aesthetic issue. No, we are talking about a clear signal that circulation is asking for help. Now imagine this scene. End of the day, heavy legs, a slight itch, that feeling that a marathon has been completed without leaving the place. This is how many people discover the first symptoms of varicose veins. The problem is that many people ignore the message. And look, keeping your legs elevated for 20 to 30 minutes makes a huge difference. This helps blood flow back to the heart and reduces discomfort. Anyone who has done this while listening to relaxing music with a little lavender oil in the room knows what I'm talking about. Real, natural, and immediate relief. And for those who enjoy more natural solutions, there is good news. Some natural remedies, such as horse chestnut extract, have demonstrated effectiveness comparable to the famous compression socks. And it doesn't stop there. Using rosemary oil with a gentle leg massage helps both circulation and the feeling of lightness. Combine this with a healthy diet. Think about including ginger, flaxseed, and garlic in your meals, and you're making a spa-worthy skincare combo without leaving home. But of course, this is just the beginning. When we talk about the causes and risk factors, the conversation becomes even more interesting. There are people who look in the mirror, see those veins appearing on their legs and think, that's just an age thing. But it's not quite like that. In many cases, the real culprit lies in the family tree. Yes, genetics matter a lot. If your mother, father, grandmother, or uncle had varicose veins, the chances increase. And you know what's curious? Even young, active, and apparently healthy people can develop dilated veins just because of this invisible inheritance. Therefore, looking at your family history is more important than it seems. Now let's talk about the elephant in the room: sedentary lifestyle and abdominal obesity. When the body accumulates fat, especially in the belly area, abdominal pressure rises and compresses the veins that try to circulate blood back to the heart. Result: venous congestion and the beginning of that ugly and painful design on the legs. A practical example: Swapping the elevator for the stairs, walking at least 30 minutes a day, or even taking short breaks at work to move your legs can already prevent a lot. You don't need to become an athlete, you just need to get out of inertia. And we can't forget a challenging phase of life, pregnancy. In addition to the increase in blood volume and the action of hormones, the growing uterus can put pressure on the veins in the pelvis, making venous return difficult. Then, my friend, varicose veins are a party. Something similar happens to those who suffer from chronic constipation. The constant effort when having a bowel movement also increases this same pressure. Therefore, including foods like chia, flaxseed, and plenty of fiber in your diet is not just about the intestine, it's about the legs too. And look closely, we are still talking about factors that many people have no idea could cause all of this. Now, what if I told you that these varicose veins have different levels of severity and that identifying this early could change everything? Many people think that varicose veins are all the same, but in fact, they have degrees, and each one tells a different story on our legs. In grade 1, the famous vessel veins begin to appear, almost like small purple or bluish webs. Seems harmless, right? But it is the body giving a subtle signal that circulation is no longer as efficient. This is where the value of prevention comes in. A light massage with rosemary oil, for example, can activate microcirculation and maintain vascular health. Small changes make a big difference, for better or for worse. In grade 2, the conversation begins to change. It's not just spider veins anymore. Now the veins are visible, tortuous and palpable to the touch. You feel that annoying cramp at the end of the day, an insistent itch or even pain when standing for a long time. It's the kind of situation that makes a lot of people turn to compression socks, and with good reason. In fact, a good trick is to use them when you wake up before getting out of bed. Another tip, elevate your legs for 20 minutes after a hard day. If you can, do this with lavender essential oil in the room. Your body and mind will thank you. In grades 3 and 4, the conversation gets serious. Constant swelling, darkening of the skin, venous ulcers and risk of thrombosis. Here, treatment is no longer optional. It is urgent. Many people ignore the problem until it screams, and when you scream, it can come with intense pain and even wounds that are difficult to heal. But don't worry, even at this stage, there is a way to alleviate the symptoms. A well-guided natural treatment can help reduce side effects and improve quality of life. Want an example? Horse chestnut extract, standardized with SNE, helps reduce leg swelling, almost like a liquid compression sock. Now, how do you know when varicose veins are really getting worse and the body is asking for help? Have you ever had that heavy feeling in your legs, as if you were carrying 2 bags of cement at the end of the day? Well, this is not common tiredness. It could be one of the first symptoms that varicose veins are developing. Combine this with nocturnal cramps, persistent itching, and an urge to urinate more frequently than normal at night, and we have an alert. It seems strange to relate the bladder to the veins in the legs, but the body is an orchestra. When circulation starts to fail, other systems adapt, often in an uncomfortable way. Another symptom that most ignore is the darkening of the skin on the legs, especially around the ankles. This happens because the still blood in the veins releases substances that stain the skin from the inside out. It's like a silent warning. Something is wrong with the venous return. Those who realize this early can avoid more serious problems, such as varicose ulcers. And a good first step? Reevaluate your diet. Reducing salt, including more garlic, ginger, and flaxseed in your daily routine, can help the vascular system breathe again. And let's face it, eating well and taking care of yourself never goes out of style. But be careful. Not all swelling or pain is a varicose vein. There is a more insidious enemy in this territory, deep vein thrombosis. The difference? While varicose veins appear slowly, thrombosis arrives suddenly, with severe pain, swelling and local heat, usually in a single leg. It is a medical emergency and needs to be treated immediately. So, if you notice abrupt changes, don't hesitate. Seek assistance. But while this doesn't happen, there are natural ways to alleviate early signs. Have you ever heard of techniques that use elevated legs and circular movements to drain excess liquid? It works a lot. In fact, in the next topic, I will show you the 3 best exercises that make this drainage happen like magic. Sometimes, relief is closer than we imagine, and without having to run to the pharmacy. A good natural treatment can be powerful, especially when used intelligently and consistently. Let's start with the favorite of natural therapists, rosemary essential oil. It is a circulation tonic, stimulates blood flow, and also brings an invigorating sensation, a golden tip. Mix a few drops of this oil with a vegetable oil, such as coconut, and massage your legs in a circular motion at night. In addition to relieving swelling, the ritual is almost like a home spa. No lines, no noise, just you and self-care. Now, if the idea is to relax your body and mind while taking care of dilated veins, lavender essential oil comes into play. It has anti-inflammatory and calming properties, which helps reduce the discomfort of varicose veins and also combats insomnia caused by pain or cramps. A good practice is to add 2 drops to your pillow or diffuser before going to sleep. Sounds simple, but it works, especially when combined with other precautions, such as keeping your legs elevated for 30 minutes at the end of the day and avoiding tight clothes that hinder circulation. And we can't forget the powerful horse chestnut, especially its extract standardized with Essin. This natural remedy is a real asset. It reduces swelling, improves the tone of the veins, and has a similar effect to compression stockings, only in liquid form. But be careful, never use the plant raw. It is toxic. Choose reliable supplements, recommended by professionals. Combine this extract with a healthy diet, rich in flaxseed, ginger, garlic, and low in salt, and you will see a positive impact on your symptoms. And do you want to know what enhances these effects even further? The right exercises, which we will explore now. If there's one thing that varicose veins don't like, it's sitting still. Blood needs to circulate, and the body was made to move. One of the best exercises that exist, and few people value it, is the calf contraction, that muscle known as the heart of the legs. Just get up and stand on your toes, holding for a few seconds, then come down. Repeat this about 15 times, 2 to 3 times a day. If you're at work, you can do it while you wait for the coffee to pass. Simple, quick, and extremely efficient to help with circulation and prevent dilated veins. Another popular exercise is lifting the legs with circular movements. Lie on the floor or bed, raise one leg, and draw circles in the air with your foot. This movement helps pump blood back to the heart and relieves that heavy feeling in the legs. You can do it while watching a series or listening to a podcast. Want to upgrade? Do this after applying a little rosemary or lavender oil. The combo relaxes and activates the venous system at the same time. And the best part, all this without leaving home, without spending a penny, and if the goal is immediate relief, here's the secret of many physiotherapists. Elevate your legs above heart level for 30 minutes. It can be supported on the wall, on a pile of pillows, or using your own support. This simple habit reduces swelling, improves symptoms, and even helps with the healing of small skin injuries. Do this 2 or 3 times a day, especially if you work a lot of time sitting or standing. Combine it with a diet rich in flaxseed, ginger, and garlic, and the results will appear. But of course, this is all even more effective with expert tips, which are little known, but make an absurd difference. Experts never tire of repeating, compression socks work. But not just anyone, they need to be prescribed individually. The wrong compression can even make the condition worse. Therefore, consult an angiologist or vascular surgeon. These socks reduce the diameter of dilated veins, improve circulation, and prevent blood from stagnating in the legs. Use them first thing in the morning, preferably before getting out of bed, and if combined with the use of horse chestnut, the effect can be even more powerful. A true dynamic duo against swelling. Another point that almost no one talks about, but makes a total difference: treating constipation. That's right. Excessive effort to evacuate increases abdominal pressure and compresses the veins in the pelvic region, which directly affects varicose veins in the legs. The tip: focus on foods rich in fiber, such as flaxseed, chia, prunes, and drink lots of water throughout the day. A regulated intestine contributes to a lighter and more functional circulation. Furthermore, if you suffer from itching, swelling, or that sensation of your legs pulsing at night, taking care of your intestines is a key point that cannot be ignored. And you can't forget the daily habits that sabotage your vascular health. Tight clothes, crossing your legs for hours, wearing high heels all day. All of this hinders circulation a lot. Smoking, then, shouldn't even be talked about. It's direct poison for your veins. The tip here is simple: dress comfortably, swap heels for anatomical shoes, and move whenever possible. Include foods like blueberries, purple grapes, ginger and garlic in your eating routine. These ingredients help to tone the veins from the inside out. And look, when this care becomes part of your lifestyle, the results don't take long to appear. And the next step, it's about reflecting on how all of this can be put into practice from now on. Now that you have this complete map in your hands, or rather, in your legs, the question that remains is, what are you going to do with this knowledge? Are you going to continue ignoring your body's signals, hoping that the dilated veins will disappear on their own? Or are you going to take the first step towards a lighter life, less pain, and much more freedom? Because yes, it is in your hands. You've already learned that healthy eating, simple exercises, natural remedies such as rosemary, lavender, and horse chestnut oil, as well as smart habits, can transform your relationship with the mirror, and with the pillow too, by the way. But tell me, what have you still been doing that hinders your circulation? Have you been standing still for a long time? Are you consuming too much salt? Still think that varicose veins are just a cosmetic problem? Comment below, I want to know, because when we share, transformation comes more powerfully. And remember, knowledge that does not become action becomes weight. And that's not the weight your legs need, right? So, if this content made sense to you, subscribe to the channel right now, activate the bell, and stay up to date with everything that can help you live better with health, lightness, and awareness. There's a lot more coming, and trust me, you won't want to miss it.